Now coming to the development of trachea, bronchi and lungs. As the diverticulum or lung buds, as they separate from the developing foregut, okay, so what happens? There will be formation of trachea. So you can see the lung buds or the diverticulum is expanding and growing caudally. So as they separate from the foregut, there will be formation of trachea and two lateral bud formation, okay, pocketing, two out pocketing on either side of the trachea, which are called as bronchial buds. So these bronchial buds, they undergo further development to form the main bronchi or the principal bronchi or the primary bronchi. Okay, so they form the two bronchi, the right and left main bronchi. Okay, so this right and left bronchi, they again divide into secondary or lobar bronchi. So the right bronchi will form three secondary and left side forms two secondary, foreshadowing the three lobes in the on the right side and two lobes on the left side of the lungs. So there will be formation of the primary bronchi will be two, or the main bronchi, right and left, will further divide or branch into three right secondary bronchi and two left secondary bronchi, which enters the each lobes of the lungs. Later, as the lung expands, you can see here the bronchi are expanding, they are branching, okay. As the lung expands, so these lung buds, they enter, so they are expanding laterally and also caudally, so they enter the body cavity. Okay, so what is this body cavity? You have learned that the lung, in the gross anatomy, the lung is surrounded by a cavity called as pleural cavity. The heart is surrounded by a cavity called as pericardial cavity. And in the abdomen, there is a very large cavity called as peritoneal cavity. So all these cavities are called as body cavities. From where it develops. So as I told earlier, how the lateral mesoderm is divided. So this is a picture showing the ectoderm, endoderm, mesoderm, which is divided into three areas: paraxial, intermediate and lateral mesoderm. Lateral mesoderm again is subdivided into somatic and splanchnic mesoderm by the development of a cavity called as intraembryonic cavity. So this is the primordium for the body cavity. So this, as the embryo grows, this cavity also expands throughout and give rise to three cavities, that is the body cavities, which includes pleural, pericardial and peritoneal cavity. So as the lung bud expands laterally and caudally, they enter a cavity called as, initially it's called as peritoneal cavity. So this cavity is present on either side of the foregut, and this channel, this cavity is very narrow initially. So as the lung expands, there will be formation of two main buds. Okay, please come over here. So you can see here, so these are the branching of the bronchi and the lungs are expanding laterally. As they expand, this you had learnt in the general embryology. So these cavities are formed due to two foldings which occur cephalocaudal area and also on the lateral foldings. Okay, so there will be from head end and tail end there will be folding, and also at the lateral aspect there will be folding, which will give rise to the tube formation, endoderm tube formation surrounded by mesoderm and ectoderm. Okay, and even the cavities expand. Okay, so this is the intraembryonic cavity, which later forms the body cavity. Okay, so here you can see the expanding lung buds, so which is laterally growing towards the pericardio-peritoneal cavity. Okay, so this is the one, the lung buds are expanding and they enter the body cavity, which is called as pericardio-peritoneal canal. Okay, so this canal later it is separated to form three cavities by formation of two folds called as pleuroperitoneal fold. I will be writing here pleuroperitoneal fold and pleuropericardial folds. So these folds separate the pleural cavity from peritoneal and pericardial cavity respectively. Okay. So there will be formation of, this is the expanding bud, lung bud. There will be formation of, so one fold you can see here. So this is pleuropericardial fold. Okay. The other one is the pleuroperitoneal fold, which will, after the fusion of these folds, there will be formation of, there will be separation of pericardial cavity from the peritoneal cavity, and the remaining cavity surrounding the lung bud will form the pleural cavity. Okay. So the remaining space surrounding the lung bud will form the pleural cavities. So how the two layers, you know that pleural cavity has two layers. Okay. So it is surrounded by two layers. One is parietal layer and other is the visceral layer. So from where these are formed. Okay. So you can see here again, this is a picture during the folding, and this is the formation of the cavities. Okay. These are the folds. Okay. So this is pleuropericardial fold, which forms later as they fuse. They form the membrane, pleuropericardial membrane, separating the pleural cavity from the pericardial cavity. Okay, the remaining space surrounding the lungs, expanding lungs, will form the pleural cavity. Okay, so this pleural cavity is surrounded by two layers, the parietal layer outside and visceral layer inside. Okay, so these two layers, the visceral layer of the pleura is derived from splanchnic mesoderm. Okay, so they are derived from splanchnic mesoderm, which give rise to the muscles, connective tissue and cartilages of the lungs. Okay, and the somatic mesoderm covering the body wall, they form the parietal layer, and the space between these two layers form the pleural cavity. So you know that here, that this is the intraembryonic cavity, so which will expand to form the three body cavities out, and these are the two mesoderm which separates. So somatic is also called as parietal mesoderm, and splanchnic is also called as visceral mesoderm. So usually it is called as somatic and splanchnic mesoderm. So the somatic mesoderm give rise to the parietal layer of the pleura, and the splanchnic mesoderm will give rise to visceral layer of the pleura, and the cavity in between these two layers forms the pleural cavity. So this is how the development of pleural layers takes place, which surrounds the lungs. Now coming to the development of the bronchial tree. So as I told, there is primary or the main bronchi, right and left, which divides into secondary bronchi, 3 on right side, 2 on left side. Okay, and these secondary bronchi further branch into tertiary or segmental bronchi, giving rise to bronchopulmonary segments. So there are 10 on each side, 10 on right side, 10 on left side. Okay, so they enter and they give rise to bronchopulmonary segments. Then these branching, mainly it is influenced by, or it is regulated by, the interaction between epithelial and the mesenchymal layer. Okay, so you know that epithelial layer is derived from endoderm and mesenchymal layer is derived from splanchnic mesoderm. So there is, when the lung buds are developing, there is interaction between the endoderm and the splanchnic mesoderm. Due to the interaction between this, it regulates the branching pattern or the branching of the tracheobronchial tree. Okay, so the primary bronchi forms the secondary, then it branches to form tertiary or segmental, giving rise to bronchopulmonary segment, 10 on each side. Then the further branching, it forms terminal bronchioles. Okay, so this forms the conducting system of the respiratory tract. And from here, this forms the respiratory, where the respiration, the proper respiration takes place. The terminal bronchioles will further divide into respiratory, from respiratory to alveolar ducts, from alveolar ducts to alveolar sac, and alveolar sac will lead into the alveoli where the gaseous exchange takes place. So these are the parts of the tracheobronchial tree, and this formation is mainly regulated by the interaction between the endoderm and the splanchnic mesoderm. So when these branching patterns are going on, there will be maturation of the lungs. Okay, so the maturation of the lungs are divided into different periods. Okay, which are the first period is the pseudo-glandular period, where there won't be much maturation of the lungs. There will be presence of this tertiary bronchi, okay, giving rise to just the bud of terminal bronchiole, and it is surrounded by connective tissue and capillaries. There is no contact with the tracheobronchial tree with the capillaries. Okay, this is a pseudo-glandular period, the initial period, which is between 5 to 16 weeks. So this is a section showing, so these are the bronchioles, okay, with the capillaries. Okay, the next stage or the next period is the canalicular period, where the terminal bronchiole, which has appeared in this period, they will branch to form the respiratory bronchioles. Okay, so in this period you can also notice there is formation of respiratory bronchioles, but they don't have any contact or connection to the blood capillaries which are surrounding. Still they are little far. So you can see here there will be formation of respiratory bronchioles, okay, and still there is no contact with the capillaries. Okay, so this period is called as canalicular period, where it is between 16 to 26 weeks. The next period is terminal or saccular period, where there will be formation of alveolar sacs. You can see here the respiratory bronchioles will lead into alveolar ducts, and that will form different sacs called as alveolar sacs, which is between 26 weeks to till birth. Okay, so this sac will form the alveoli. Okay, one more important thing which you have to notice here, the capillaries have come in contact with the epithelial cells. Okay, so this is very important, the contact between the epithelial cells of the alveoli with the capillaries, which is very important for the gaseous exchange, which occurs at this period of terminal or saccular period, that is just after the 7th month the connection appears, that is between 26, and it goes on till birth, the branching, okay, and further maturation goes on till birth and also continues after birth also. Okay, so at the terminal or saccular period the capillaries will come in contact, which can lead to gaseous exchange. So if the baby is born, if the neonate, the fetus is born after 7th month also, there are chances that the neonate can survive if the baby is born after 26 weeks, but there should be extra care also. Okay, then the next period is the alveolar period, which at the last month, just that is from 8th month till it continues after the birth, so till the childhood, where the maturation, the branching goes on increasing, okay, and even the contact with the capillaries, and there will be more formation of capillaries which goes on after birth also. This is the 4th period of maturation of lungs. So this table will summarize everything. First is a pseudo-glandular period, canalicular period, terminal saccular period, and the alveolar period. When this maturation is going on, you have to notice the most important thing here, where there will be 2 types of cells in the alveoli. Okay, the respiratory bronchiole, which is leading into the alveolar duct, sac, and the alveoli. There will be formation of 2 types of cells, which are called as type 1 alveolar cells and type 2 alveolar cells. So when you see type 1 alveolar cells, they become flat and they are in contact with the endothelium lining the capillaries. So you know that the lining epithelium of the blood arteries or capillaries is called as endothelium. So this type 1 alveolar cells, they become flat, okay, squamous in nature, okay, and they come in contact with the endothelium of the capillaries where the gaseous exchange takes place. Okay, so these are called as type 1 alveolar cells. There are some cells which are cuboidal in nature. They don't become flat. They are cuboidal in nature. They are called as type 2 alveolar cells. Their main function is to produce surfactant. Okay, so what is this surfactant? Okay, it is a phospholipid which is very important. Okay, which prevents the collapse of the alveoli. Okay, so it is a fatty phospholipid which are produced by type 2 alveolar cells. Okay, so the surfactants starts appearing. Okay, the production of surfactants will start when there is 2 months. Okay, like at around 8th month. Okay, after 7th month or 8th month, there will be production of surfactant, and the production goes on increasing, and by about 34th week, as the production increases, they also say that this surfactant also influence the contraction of the uterus. They say that the surfactant are they enter the amniotic fluid, and from the amniotic fluid it enters through the chorion, it enters the mother's uterus, and it also influences for the uterine contraction. Okay, so that is one of the function of the surfactant. So the main function of the surfactant is it prevents the air blood interface, and it it lowers the surface tension. Okay, so which helps in preventing the collapse of the alveoli. So when you see the fetal lung, okay, when you observe the fetal lung, when you take a section of the fetal lung, the alveoli will be filled with fluid. Okay, the lumen of the alveoli will be filled with fluid which are rich in protein, okay, and also rich in chloride. So what happens whenever the baby is born premature, when there is delivery of the baby before 7th month or before 32 weeks, so what happens, the lungs have not matured, there is no enough of surfactant, and the alveoli lumen will be filled with fluid. So what happens, there will be difficulty in breathing, okay, and that leads to, since there is no enough production of surfactant, so the surface tension will be high, and that leads to collapse of the alveoli. Okay, so this condition is called as respiratory distress syndrome, okay, which I had told, had given a case at the beginning of the session where the baby was born at 32 weeks and had difficulty in respiration. Okay, this can be one of the reason where there is no enough production of surfactant, because the surfactant production increases after 7th month. Okay, by 34 weeks there will be increased the production of surfactant. Since the baby was born at 32 weeks, so there might be collapse of the alveoli, which has led to respiratory distress. Okay, and you can see, since the alveoli are filled with fluid which are high in protein, so when you saw the X-ray, there was complete opacities on both sides of the lungs. Okay, so you know that the lungs look translucent whenever it is filled with air. Okay, since the alveoli are filled with fluid, that's why you can see opacities. Okay, so this is one of the signs for respiratory distress syndrome. So, but this is the most common cause for the death of the neonate, but this can be prevented. So if the mother has a condition where she should undergo preterm labor, so the mother can be treated with glucocorticoids, which helps in more production of surfactant. Or if at all the baby is born preterm, so extra neonatal care can be given, or the surfactant can be injected so that the lungs won't collapse, the alveoli won't collapse, and you can prevent from the neonatal death. Okay. So this is again a picture. So the barrier is formed when the capillaries are in contact with the alveoli. So this is the type 1 alveolar cells. This is the endothelium forming a blood-air barrier in the lung where the exchange of gases takes place. So as I already told about the respiratory distress syndrome, okay, so in a normal lung it will be filled with, as you know, and also they say that the fetal breathing movement starts before birth, which is very much important because the amniotic fluid is taken up by the fetus, okay, which is the amniotic fluid is very much necessary for the lung maturation and also to condition the respiratory muscles, okay. So though the breathing movements occur before birth, okay, the proper respiration starts at the time of the birth, okay. So at the time of the birth, the fluid which are filled within the alveoli lumen are reabsorbed immediately by the blood capillaries and the lymph capillaries, okay, and the small amount is expelled out through the trachea and bronchi, okay, and then the surfactant will form a layer around the alveoli which will prevent the collapse of the alveoli, okay. So but if there is no enough production of surfactant, so you can see the appearance of the lungs, there will be opaque lung because since it is filled with fluid and there is no enough production of surfactant. So this shows the difference between the normal lung and the neonate with respiratory distress syndrome. Now coming to the development of diaphragm, though the diaphragm is covered at the development of the body cavities, since diaphragm is a part of the respiratory system which forms the muscle of respiration, so I will be covering the development of diaphragm in this session only. So you know that diaphragm has muscular part, membranous part and also tendinous part, okay. So each part, the diaphragm develops from different embryonic structures, okay. So one of the structure you have to know is the septum transversum, okay. Septum transversum is a very important, it's a plate of mesenchyme which develops from the ventral aspect, the ventral wall, body wall, and grows dorsally to join with the other folds to complete the development of the diaphragm, okay. So this septum transverse is nothing but the mesenchymal tissue, a plate of mesenchymal tissue which appears during the folding time. When the cephalocaudal and the lateral foldings are occurring, there will be formation of a plate between the thoracic and abdominal cavity, the mesenchymal plate, and that plate is called as septum transversum. So they develop, this mesenchymal plate develops from the ventral wall and they expand growing towards the dorsal side, okay. So this septum transversum mainly gives rise to central tendon of the diaphragm. You know that diaphragm has a tendon at the center, okay. So this forms a central tendon of the diaphragm, okay. The next part is the pleuroperitoneal membrane. So I had told earlier during the development of the lungs, okay, there is pericardio-peritoneal canal, okay, which is the primordium, the body cavity where the lung expands into this cavity, okay. So this pericardio-peritoneal canal is separated into three different cavities by formation of two folds which are called as pleuroperitoneal folds and pleuropericardial folds. So the name only tells you that pleuropericardial fold separates pleural cavity from the pericardial cavity. So that doesn't come into picture in the development of diaphragm, okay. The fold which comes into picture in the development of diaphragm is the pleuroperitoneal folds, okay. So this pleuroperitoneal folds I had shown in the earlier picture, okay. So this is the pleuropericardial fold which is separating the cavity surrounding around the heart and cavity around the lungs. So this is separating the pleural cavity from the pericardial cavity. So that is pleuropericardial fold, okay. There is one more called as pleuroperitoneal folds, okay. So this pleuroperitoneal folds, they start appearing on either side of the foregut, okay. Then they move towards each other, okay, and then they come in contact with the mesentery, okay, the mesentery, the dorsal mesentery which is holding the esophagus. So when you see the endoderm tube, okay, which is divided, imagine this is the endoderm tube, okay, so which is divided into foregut, midgut and hindgut, okay. So this foregut part is connected ventrally and dorsally by two mesentery which is called as ventral and dorsal mesentery. mesentery is the layer of mesenchyme. So when you see midgut and hindgut, they are also supported dorsally by dorsal mesentery, but they don't have mesentery on the ventral aspect. So ventral mesentery is only seen at the foregut area. So the foregut area, which is giving rise to esophagus, even they are supported by a mesentery called as dorsal mesentery. Okay, so if you see in this picture, this is the esophagus. So this is held in position dorsally by the dorsal mesentery. So the two folds which are approaching each other on either side, pericardio-peritoneal folds, they come in contact. So initially there is communication between the pleural cavity and the pericardial cavity. Okay, so once this membrane comes in contact with the mesentery surrounding the esophagus, this completely closes the communication that is between the pleural and the pericardial cavity. Okay, so this pericardio-peritoneal folds, initially it is fold, once they approach each other and they fuse, it forms the membranous part of the diaphragm. Okay, so the two pleuroperitoneal membrane, they give rise to the membranous part of the diaphragm. So septum transversum forms the central tendon, then pleuroperitoneal membrane forms the membranous part of the diaphragm. So as the lung expands laterally, there will be formation of a rim around here. So you can see a red marking here. There will be a formation of a rim which is contributed by the somites from the cervical segments. I had told about the paraaxial mesoderm. Okay, intraembryonic mesoderm is divided into three parts: paraaxial, intermediate and lateral. So the paraaxial, from head end to the tail end, there will be formation of different bricks, pairs of bricks on either side. So these bricks are called as somites, which has muscular component, okay, connective tissue component, all those. So these somites, especially from the cervical segment from C3 to C5, okay, from C3 to C5, they migrate from there and they form a rim around this area, okay, which is giving rise to the muscular part of the diaphragm. So that's why when the somites are migrating, even the nerves are migrated. So you know that C3 to C5, the nerve is the phrenic nerve, okay. So the muscles forming the diaphragm, okay, the muscle part of the diaphragm, since it is derived from the somites at the cervical segment from C3 to C5, so that's why they are supplied by phrenic nerve, okay. So this is three parts over: tendon is over, membrane is over, muscular part is also over. Then you have also heard that diaphragm has two legs which are attached to the vertebrae, okay. So these two legs are called as crura, okay. So this crura develops from the mesentery of the esophagus. So you have to remember four components in the diaphragm: central tendon, membrane, muscular part and the crura. So the central tendon develops from the septum transversum. It is nothing but the mesenchymal plate, okay, appearing in between the thoracic cavity and the abdominal cavity during folding, okay. Then the membranous part is from the two membranes, two folds, that is a pleuroperitoneal membrane, okay. Muscular part is a small rim around, okay, the component derived from the somites at the cervical segments from C3 to C5, okay. And the two crura is plural, okay, is from the mesentery, okay, the mesentery which is holding the esophagus dorsally, it gives rise to crura of the diaphragm. So this is the development of the diaphragm, okay. So whenever there is failure, especially the pleuroperitoneal membrane, since they have to migrate, okay, not migrate, they have to approach each other and they have to fuse with the mesentery. So whenever there is failure in the formation of this membrane, it can lead to hernia, okay. So this condition is called as congenital diaphragmatic hernia, which is most common at the posterior wall, because the membrane the fold has to form, okay, at the posterior aspect, and then they have to approach each other. So if there is abnormality, failure in the formation of this pleuroperitoneal folds, okay, there can be communication between the thoracic cavity and that is the pleural cavity and the peritoneal cavity, okay, which can lead to congenital diaphragmatic hernia, which is the most common type. Okay, so even in this picture it shows the different components of the diaphragm. Okay, so here it represents, and even in the mesentery there are 3 openings for the entry and exit of different structure. You know that diaphragm has 3 openings which gives the entry. There will be entry of the abdominal aorta, then there will be esophagus, okay, with other veins and all, okay, and also the inferior vena cava. Okay, so there will be 3 openings here. Okay, 3 represents here the muscular somites, which is giving rise to the muscles of the diaphragm. 1 represents the pleuropericardial membrane. 2 represents the septum transversum. So this is the formation or the development of diaphragm. Okay, this completes the development of respiratory system. Thank you.